Hi friends, welcome back to my YouTube channel, Govind Narayan Purohit, and in our current lectures we are discussing the MCQs in theriogenology. I am highly thankful to all of you who have subscribed to my channel. If you have not already subscribed, kindly do subscribe to it so that you receive the notification of our video lectures very fast. Friends, in my attempt to help you out in preparing for your examinations, this is my next attempt to help you out by bringing in discussing the MCQs in obstetrics. Friends, since your examinations are very near, I thought I should hurriedly bring about some of the very peculiar MCQs which probably might be helpful to you. So, with wishing you all good luck, let us start with the MCQs on the obstetrics. So friends, let us start the question answer series. Currently we will be discussing about the MCQs on obstetrics. It's beyond my approach to present all the possible MCQs in one lecture, but I thought since your examinations are very near and you are preparing very hard, so I thought I must help you to understand some of the most peculiar MCQs that are possible in obstetrics. So the first one is, a breed of pigs known to have a higher incidence of mummified fetuses is Duroc, Berkshire, Hampshire and Yorkshire. Now the breed of pigs which is known to have a higher incidence of mummified fetuses is Berkshire, right? So that is the right answer. Then the next question, in cattle, delivery of mummified fetus with normal fetus. One of the fetus is a mummified one, another one is a normal fetus. This is known as static fetal cadaver, stillbirth, premature birth, abortion. Now abortion has been defined as the delivery of a fetus before completion of gestation which is incapable of independent life. Any fetus that is delivered before completion of gestation which is incapable of independent life, say if it is born, then it will die because it is not able to sustain life. That is abortion. Then premature birth is the delivery of the fetus which is capable of independent life. Say in cattle it is said that any fetus born beyond 8 months is capable of independent life. So that is premature birth. Then the term stillbirth, the delivery of a dead fetus with cattle, has been banned by the Bovine Society for Nomenclature, and they say stillbirth is a more appropriate term for pigs, but it should not be used for cattle. So the right answer is static fetal cadavers, right? Which of the below mentioned is not a fetal dropsical condition? Fetal ascites is accumulation of fluid in the abdomen of the fetus, so it is a fetal dropsical condition. Hydrocephalus is the accumulation of fluid in the meninges of the brain of the fetus, so again it is a fetal dropsical condition. Anasarca is the accumulation of the fluid. Generalized subcutaneous, a fetus with generalized subcutaneous accumulation or generalized subcutaneous edema is known as Anasarca. So Hydroallantois is the accumulation, is a dropsical condition of the mother and not of the fetus. Excessive fluid accumulation in the allantoic cavity. So Hydroallantois is the right answer, right? Fetal Anasarca is common in fetal Anasarca is common in Holstein cows, Jersey cows, Ayrshire cows, and brown Swiss cows. Fetal Anasarca is common in Ayrshire cows, right? So that is the right answer. Neuropathic hydrocephalus is a lethal genetic condition caused by recessive mutation that affects Hereford cattle, Belgian blue cattle, Holstein cattle, and Angus cattle. Sorry, the answer has been highlighted here, so it's found in Angus cattle, right? Now the chromosome number of river buffalo is 2n is equal to 50, 2n is equal to 48, 2n is equal to 60, 2n is equal to 64. 2n is equal to 60 is the chromosome number of goat. 2n is equal to 64 is the chromosome number of horse, and 2n is equal to 48 is the chromosome number of swamp buffalo. So 2n is equal to 50 is the right answer, right? Match the following: Hydroallantois, perineal hernia, desmoraxis, pregnancy toxemia, and the options are heavy idle mares, twin pregnant sheep and goats, watery fluid 80 to 200 liters. This is found in Hydroallantois. Now, perineal hernia is a problem of aged dogs. Desmoraxis or the prepubic tendon rupture, it is also known as the prepubic tendon, occurs in heavy idle mares, and pregnancy toxemia is a problem of twin pregnant sheep and goats. So 1C, 2D, 3A and 4B. So 1C, 2D, 3A and 4B. This is the right answer, right? Another match the following: hyperlipidemia, single pop syndrome, placentitis and hydroamnion. Hyperlipidemia occurs in donkey mares. Single pop syndrome is commonly found in the bitch, where the presence of a single pop delays the parturition. Placentitis occurs in pregnant mares, and in hydroamnion the fetus is abnormal. So again 1C, 2D, 3A, 4B. This is the right answer, right? A cross between donkey and zebra is called Zors, Mule, Hinny and Zebret. Zors is the cross between zebra and horse. Mule is a cross between mare and jackass, or mare and male donkey, or mare into jackass. That is mule. And Hinny is the cross between a stallion and a donkey mare. Right? So Zebret is the cross between a donkey and a zebra, right? So that is the right answer. When an ovum is activated by sperm which do not take part in fertilization, this is known as androgenesis, agynogenesis, parthenogenesis and superfecundation. In androgenesis, the ovum is activated by a sperm, but the ovum does not take part in fertilization. In parthenogenesis, the ovum is activated by means other than sperm. So that is parthenogenesis. Superfecundation is a term used to explain a female which comes into estrus, releases many ova, and these ova are fertilized by mating with two or more different males. So that is superfecundation. So the right answer is agynogenesis. When an ovum is activated by sperm which do not take part in fertilization, that is known as agynogenesis, right? So that is the right answer. An animal with XXY chromosomes is known as Turner syndrome, aneuploidy, Kleinfelters syndrome, and polyploidy. Aneuploidy means the duplication of chromosome number, but one is in excess or one is lacking. So 2n plus minus 1, that is aneuploidy. And polyploidy is absolute duplication, absolute increase in the chromosome number. So it is 3n or 4n, like that. Turner syndrome is XO and Kleinfelter syndrome is XXY. So Kleinfelter syndrome is the right answer, right? Fawn-Calf syndrome is a heritable defect of fetus with muscle contracture and angulations of stifle and is found in Hereford cattle, brown Swiss cattle, Angus cattle, and Carolais cattle. Now, Hereford cattle and Carolais cattle will have double muscling. So, they will have double muscling. There are many beef breeds which will have double muscling of the fetuses. Then brown Swiss is a dairy breed. So, fawn-calf syndrome is not found in that. So, Angus is the right answer, right? A fetal monster with congenital curvature of the spine and the abdominal viscera exposed is known as Cystosoma reflexus, Pyrosomus elumbis, Cyclopia, and Holocardius amorphous. In Pyrosomus elumbis also there is congenital curvature of the spine, but there is the ankylosis of the small limbs. In Cyclopia, there is a single orbit. Animal will have only one eye in the center and not on both the sides of the head. So that is Cyclopia. Holocardius amorphous or Amorphous globosus, it is also known as, is a monster in which it does not have a clear-cut body form. But Cystosoma reflexus, there will be congenital curvature of the spine and the abdominal viscera is exposed because of a vent in the abdominal wall. So that the correct answer is Cystosoma reflexus, right? A twin fetus joined at sternum is known as Ichthyopagus, Craniopagus, Thoracopagus, and Pygopagus. A Pygopagus is a monster or a twin monster which is joined at the sacrum. The Ichthyopagus is a monster which is joined at pelvis. Craniopagus is a monster which is joined at the head. So Thoracopagus is the monster joined at the sternum. That is the right answer, right? The reduction in the size of the genital tract postpartum is known as involution, lochia, Peurperim, and ovarian rebound. You see, after during the postpartum period, there are the uterine reduction starts, and the ovaries also, they start functioning after a certain time period. That is known as the ovarian rebound. And Peurperim is the period when the first FSH is released and progesterone block is removed. Lochia is the discharge that comes out through the vagina. So the reduction in the size of the genital tract postpartum is known as involution, reduction in the size. And during involution there is lochial discharge, And during the puerperal period, the animal regains the sensitivity towards GnRH. Right? So involution is the right answer. The relationship of the head and extremities of the fetus to its own body during delivery is known as presentation, position, posture, and normal birth. You see, presentation is the relationship of the long axis of the fetus to the long axis of the mother. So presentation can be anterior if the forelimbs come along with the head, posterior if the hind limbs come first. It is transverse if dorsotransverse or ventrotransverse, like this, which is common in mares. That is the presentation. Position is the relationship of the dorsum of the fetus with the quadrants of the mother. So it could be dorsosacral, dorsopubic, dorsoileal. So that is position. And normal birth, that has no relationship to the question that has been asked. So it's the posture, relationship of the head and extremities of the fetus to its own body. That is posture, right? So that is the right answer. The most common cause of dystocia in the bitch is fetal malpresentation, uterine inertia, pelvic fracture, uterine torsion. Look, in cattle, fetopelvic disproportion and fetal malpresentation is the commonest cause of dystocia. In buffalo, the commonest cause of dystocia is uterine torsion. Pelvic fracture is an uncommon cause of dystocia. So in the bitch, the commonest cause of dystocia is uterine inertia, right? Which can be primary or secondary, primary partial or primary total, right? So uterine inertia is the right answer. The most common cause, common maternal cause of dystocia in the buffalo is uterine torsion. 70% of the cases of dystocia in buffalo are because of the uterine torsion. Cervical dilation failure is less prevalent in buffalo as compared to cattle or other species. So uterine torsion is the right answer, right? Now this is a reasoning type of question. A buffalo with right-sided uterine torsion is placed in right lateral recumbency and rotated to the right side. The explanation is the uterus being heavier do not rotate with the animal's body and thus the torsion is corrected. Yes, so both the statements are correct. So statement A is correct and statement B is the correct explanation of statement A. That is the right answer, right? Cervical dilation problems, ringworm are common in cattle and buffalo, mares and donkeys, sheep and goats, dogs and cats. Ringworm is common in the small ruminants, sheep and goat. So that is the right answer, right? Beta-2 adrenergics such as isoxsuprine hydrochloride are suggested for cervical dilation problems, correction of uterine torsion, therapy of uterine inertia, delivery of small fetus. No, for therapy of uterine inertia, beta-2 adrenergics are not suggested because they will then increase the inertia. For uterine torsion, they will be of little help. For delivery of small fetus, no, beta-2 adrenergics are of no help. So, for cervical dilation problems, beta-2 adrenergics are suggested, right? So, that is the right answer. Prolapse of urinary bladder through urethra or vaginal rupture is known as hysterocele, vaginal cystocele, urocele, hernia. Hernia is the protrusion of the abdominal organs through a rupture in the muscle, and that is hernia. Urocele is the accumulation of urine in the testicle, and hysterocele is the herniation of the uterus with a rupture in the abdominal vessel, that is hysterocele. So vaginal cystocele, prolapse of urinary bladder through urethra or vaginal rupture is known as vaginal cystocele, right? So that is the right answer. A fetal presentation in which the head and both fore and hind limbs are presented in the vagina is known as Ventrovertical presentation, simultaneous presentation, caudal presentation, cranial presentation. Now, the name given to anterior presentation and posterior presentation could be cranial and caudal. But in these, not all the limbs will come along with the head. In simultaneous presentation, maybe 2 limbs of one fetus and 2 limbs of another fetus may come in the birth canal, but they will be different because maybe they are hind limbs. So, ventrovertical presentation or dog sitting posture, that is the right answer, right? The most difficult fetal position in the birth canal for delivery is dorsosacral, right dorsoileal, left dorsoileal, dorsopubic. You see, dorsosacral is the normal position of the fetus during delivery, and slight rotation to the right or the left can be corrected easily by rotation. But dorsopubic, if the dorsum of the fetus is towards the pubis of the mother, that is the most difficult fetal position for delivery, right? So that is the right answer, right? General anesthesia is suggested before rolling for correction of uterine torsion in the buffalo, cow, goat, mare. You see, general anesthesia is essential for the mare. So mare is the right answer. No anesthesia is required for cattle, buffalo or goat, right? So that is the right answer. In obstetrics, operations performed on the fetus to bring the fetus back to its normal presentation, position and posture are known as mutation, retropulsion, version and rotation. Rotation is the rotation of the fetus on its axis. Version is the rotation of the fetus. It is limited to 90 degree, frequently performed in transverse presentations. And retropulsion or pushing the fetus back into the abdominal cavity is known as retropulsion. And mutation are all those operations performed to bring the fetus back to its normal presentation, position and posture. So mutation will include repulsion, rotation, version, extension and adjustment of the extremities. So mutation is the right answer, right? Version is limited to 90 degree and is frequently indicated for correction of transverse presentation, dog sitting posture, breech presentation, hip flexion. Version could be of little help in hip flexion or dog sitting posture. It will also be of little help in breech presentation. So it is helpful in transverse presentation, rotating from this type, this is the birth canal, rotating from this to this type. So it is best for transverse presentation, commonly occurring in mares. Which of the following is not useful in canine obstetrics? Vectis, whelping forceps, snare and forceps, and long blunt hook. You see, long blunt hook is a very long blunt hook which is used for obstetrics in cattle. So this is of no use. Vectis is a small instrument used for canine obstetrics. Similarly, whelping forceps and snare and small forceps can be helpful. So long blunt hook is the right answer, right? The prerequisite for performing fetotomy on cows is fetus is dead, fetus is live, fetus is in normal presentation, position and posture, fetus is beyond the reach of the pulpator. Now, if the fetus is beyond the reach of the pulpator, then fetotomy cannot be performed, and it has nothing to do whether the fetus is in normal presentation, position and posture. Fetotomy is contraindicated in live fetuses. So fetotomy is only performed when the fetus is dead. So that is the right answer, right? Percutaneous fetotomy is essentially done using a fetotome, obstetric hook, obstetric knife, scalpel. Obstetric knife and scalpel can be used for subcutaneous fetotomy, but they are of little help in percutaneous fetotomy. Obstetric hook is for pulling of the fetus, so it has nothing to do with fetotomy. So Hygerson's fetotome, Utrecht fetotome, whichever fetotome is essential, right? So that is the right answer. In controlled vaginal delivery in the mare, general anesthesia is administered and the hind legs are lifted upwards. Delivery is controlled through vagina. Pituitome is used per vaginum. Fetus is pulled slowly. You see, in equine obstetrics, the obstetrical operations have been defined into assisted vaginal delivery, the controlled vaginal delivery, pituitomy, and caesarean section. Now, in controlled vaginal delivery, general anesthesia is given to the mare and the hind legs are lifted upwards so that you can one can pull out the fetus easily and one can manipulate easily. So, general anesthesia with lifting of the hind limbs is the right answer, right? Landrace breed of pigs is susceptible to epidural anesthesia, halothane anesthesia, diazepam, ketamine. It is susceptible to halothane anesthesia, right? So that is the right answer. For prevention of prolapse, Winkler's operation is the technique of fixing the cervix with the vagina, prepubic tendon, vulva or broad ligament. You see, in Winkler's operation, a needle is taken and that fixes the vagina with the prepubic tendon, that fixes the cervix with the prepubic tendon that lies underneath. So, prepubic tendon is the right answer, right? So, this is again a reasoning type of question. The placental separation starts a few weeks before birth and the placenta is dropped within 8 to 12 hours of parturition in cows. Now, the reasoning is increased fetal serotonin during late gestation causes decrease of blood supply and increased release of collagenase that breaks down collagenase bonds and helps in loosening of the fetal cotyledons. You see, there is bonding collagen bonds between the caruncle and the cotyledon. So these must be loosened. So the increasing levels of fetal serotonin during late gestation release collagen from the uterus and this collagenase breaks the bonds. So this is the correct explanation. So statement A is correct and statement B is the correct explanation of statement A. That is the right answer, right? The deficiency of which of the below mentioned mineral and vitamin is associated with increased incidence of retained placenta in cows? Magnesium and vitamin B12, selenium and vitamin E, iron and vitamin C, cobalt and vitamin B6. It's clearly known that deficiencies of selenium and vitamin E can increase the incidence of retained after birth in dairy cattle. So that is the right answer, right? Which of the following drug is suggested for therapy of profuse uterine bleeding following delivery of the cow? Vitamin C injection, adrenaline injection, oxytocin injection, vitamin K injection. Look, during the postpartum period, because some injury in the uterus can lead to bleeding. So, although vitamin C, adrenaline, vitamin K are all suggested for stopping the bleeding, but during the immediate postpartum period, the most appropriate therapy would be oxytocin, because that will reduce the size of the uterus and that will increase the contractions, contracting the vessels, right? So that is the right answer. For expulsion of retained placenta in the mare, bolus injections of oxytocin 80 to 100 international units are not currently suggested as they may cause uterine rupture, excessive milk letdown, colic and hypersensitivity. No, they will not cause any hypersensitivity. Oxytocin is not a protein, so it will not cause hypersensitivity. Uterine rupture, no, it will not cause uterine rupture during after fetal delivery. Excessive milk letdown, no. It can precipitate colic and that will be problematic. So colic is the because so currently it is suggested to use 10 to 20 international units every hour for expulsion of placenta in the mare, and that will not cause colic, right? So that now the next question is obturator paralysis commonly occurs in cows with dystocia due to dog sitting posture, hip lock condition of the fetus, shoulder flexion, uterine torsion. Now obturator paralysis occurs because of hip lock condition. So hip lock condition is the right answer, right? A 2-year-old bitch with serosanguinous or bloody discharge 8 to 16 weeks post whelping without fever is most likely suffering from metritis, subinvolution of placental sites, retained after birth, and uterine rupture. No, a bitch with uterine rupture may die, and it will not survive for 8 to 16 weeks. And a bitch with metritis frequently occurs during the immediate postpartum period, and the bitch may have fever and lethargy and many other problems. Retained after birth can occur in the bitch, but it does not continue up to 8 to 16 weeks postpartum. Subinvolution of the placental sites is the common cause of bloody discharge in a bitch, because this is a common problem in the bitch. Subinvolution of the placental sites, right? This is subinvolution of the placental sites, right? That is the right answer. And the next question. Serum calcium levels in bitches with eclampsia are as low as 20 to 30 milligrams per deciliter, 10 to 15 milligram per deciliter, 9 to 11 milligrams per deciliter, and 4 to 7 milligrams per deciliter. You see, the normal serum levels in bitches are 9 to 11 milligrams per deciliter. So it cannot increase in bitches with eclampsia. So these two options are not correct. They can only decrease. So 4 to 7 milligram per deciliter is the right answer, right? So thank you very much for your patient listening. Kindly give your comments, give suggestions, share the video, subscribe to my YouTube channel Govind Narayan Purohit if you like it. You can contact me at my email GNP obstetrics@gmail.com. I will be more than happy to answer any of your queries, any of your questions. Prepare seriously for your exams and get success. Thank you. Bye-bye.